All right, let's go ahead and get started. Looks like we have a small group today on the call with us. We have Justin Newsom. He is the BioTE rep. He's going to be here to answer any questions for us. And then we also have Mickey Fletcher. She is our front desk assistant. She's going to be helping moderate for me today. So I have a short presentation, and then if you have any questions, Kristen, you can just type them in on the side. You can ask them as we're going along, or you can ask them at the end. We'll have a little bit of time. So unless anybody has anything, we're going to go ahead and get started. All right. So there's our slides. All right, so obviously today we're going to be talking about hormone replacement and specifically BioTE hormone replacement. This is the company that I have been working with for over a year and a half. And not only do they provide excellent service, but their pellets are top of the line, and we really love what they do for our patients. My name is Dr. Kim Harris. I'm a naturopathic doctor. I'm licensed here in the state of Arizona. I've been practicing for about 6 years now, and we focus here mainly on aesthetics and hormone replacement for men and women. All right, so hormones is definitely a popular topic these days. Today we're going to be talking about what hormones are, what they do in the body, and then we'll talk a lot about some hormonal imbalances that patients might be experiencing and what we can do about it. So what do we need to know about hormones? These are the topics for today. Who can and should you believe as far as hormone replacement? Because there's a lot of kind of competing information out there. And then what are some solutions to that problem? So let's just talk a little bit about what hormones are. The most popular ones that most people have heard of obviously would be like estrogen and progesterone. And testosterone, those are the sex hormones, and obviously there's large differences between men and women and their hormone levels. But, thyroid is also a hormone, and then cortisol. There's other hormones that kind of regulate how we like hunger and how we process blood sugars. But basically they're chemical messengers that circulate in the body, and they only they kind of go into their lock, so they are specific to different types of receptors. So like, for example, estrogen in women, we have estrogen floating around, but then we have estrogen receptors in certain areas of the body, like breast tissue, uterine tissue, endometrial tissue. And then we also have testosterone. So, we kind of look at this throughout the aging process as, we are losing hormones. What's causing that? Is it actually aging, or, are there other factors? And so, what kinds of things can we do to prevent that process from happening? So a lot of patients come in and they're having a wide variety of symptoms. And, people feel like this these days. They may feel, especially men, they may feel irritated, angry, frustrated, and, have difficulty with work. So, do you feel like this, or are you feeling balanced? Do you feel happy and connected with your spouse? Are you able to be active and live life to the fullest? Commonly, patients come in and they, feel obviously a lot of stress, anxiety, fatigue is a huge thing. You feel, like this, or are you feeling happy? Do you feel like you are living your best life? And that's kind of our goal for our patients, is to get them to, feel good for their age. So the biggest symptoms that I see in office Mainly are honestly fatigue. As people get older, they start to feel that tiredness that can come on. It can be all day, it can be in the afternoon. Mood swings are very common, along with anxiety and depression. And we may not necessarily relate those with the loss of hormones, but I see that as a huge symptom for men and women with low testosterone. Difficulty sleeping, patients who have memory loss or lack of focus, especially at work. And then, obviously the more common symptoms with menopause, where we get hot flashes and night sweats that everybody knows about. And, weight gain is very common in women. And then, we also have issues with sex drive and libido, and that can really affect relationships and marriages. So a little bit about myself, why I decided to get into BioTE hormone replacement. I was trained on hormone replacement in school, but we really only learned how to do topical applications of estrogen, progesterone, and testosterone. But over the years, just seeing that method doesn't work for every patient. They are on these hormones for long amounts of time, but they still don't feel very good. I kind of started looking into other ways to do hormone replacement. I'd heard really great things about BioTE and that method of replacement. And so I decided to look into it. And I, got trained about a year and a half ago, and I've been doing it ever since. So a little bit about BioTE and what it does. So the pellets themselves are testosterone and or estrogen, depending on symptoms and the patient. And then the rest of that picture to balance out the whole patient is progesterone, depending on the patient and symptoms, and then thyroid, and that really depends on lab work. So that's kind of where we get started. It's a whole patient picture. It's individualized to each patient and their labs and their symptoms. And then BioTE also offers supplements, nutraceuticals that can help reduce side effects, helps make the treatment more effective, and can help overall with more hormone balancing. Let's talk a little bit about the guys, because testosterone replacement is becoming extremely popular these days for good reason. So andropause starts to affect men sometimes in their 30s, where they start to get a decline of testosterone production. There's a lot of different factors that go into that. Mainly, we're looking at, lack of exercise and lean muscle mass, but also there are a lot of environmental factors that go into reduced testosterone production. So we see a lot of men coming in who, not a lot of men. Men don't like to come into the doctor's office, but when they start to feel that really fatigue and loss of libido or difficulty with sexual performance, or more commonly, they're just irritable and having trouble performing at work, a lot of times that can be related to testosterone levels that are really low. So 20% of males over 50 have low testosterone, but I actually probably think that number is higher. I would say, it's probably closer to half of males have suboptimal testosterone. Other common comorbidities that we see with patients that have low testosterone would be like blood sugar issues, elevated blood pressure, problems with sleep, and other chronic disease. And it's also linked to early heart disease and other conditions that we're going to talk about in a few minutes. So testosterone replacement, we do it in men and women. And before I started with BioTE, I did not actually realize how important testosterone replacement was for women. I thought, kind of the way we were trained that Testosterone is used in very low doses for women that have difficulty with libido, and that's it. But the more I learn about it and the more I experience testosterone replacement myself, I see the kind of wider ranging effects with that. So for testosterone, what we see from the research really is that it helps with bone protection of your bone health, brain health, breast, and heart health. And obviously men get much higher doses of testosterone than women, but it can be really life-changing for women as well. Positive effects we see most commonly with patients. I see increased libido and sex drive, which is has huge effects on relationships. We talked a little bit about the protective factors of it: brain, heart health, bone protection, but we also see increased muscle strength and lean muscle growth. So that can play into a little bit of weight loss and people performing better at the gym. And then the other big area that I see testosterone helping men and women is just in being more productive. So patients will come in and, they can get through their day, they can do what they need to do. But with testosterone, they feel more energized. Mental clarity is better. So it really helps like in the work arena as well. We'll talk a little bit about females and hormone replacement. This is probably better known. More women seek out medical care, and and they are. Sorry, I got distracted by a question. Because we experience such significant side effects in menopause, with hot flashes and night sweats, and it's very sudden, where for men, it's kind of a slower onset. But for women, it can be very sudden and very severe. And Kristen, I'm going to get to your question in a few minutes. We're going to talk about the different types of hormone replacements, conventional and alternative, and we'll talk about creams and their efficacy. So menopause, anywhere from 45 to 55 for most women. And it can be kind of a slow onset, or it can be really quick. And those symptoms that women experience can last up to 15 years. So you may not get hot flashes forever, but you may experience, the vaginal dryness, loss of libido, cognitive decline, brain fog. Those kinds of symptoms really can last a lot longer. And most women do find that they experience really long-lasting effects from menopause. The other issue that we see with menopause is that heart disease increases quite a bit after you lose that estrogen and progesterone. So it is not just a quality of life issue, but it is a health issue as well. All right. So when we're looking at estrogen replacement, most people know that it does control hot flashes and night sweats, but also it helps with collagen and elasticity in the skin. So, women tend to look better when they're on estrogen. And it can help with some of the anxiety and depression that goes along with menopause and losing those hormones. And we do see increased bone strength. So we're going to talk a little bit about osteoporosis and osteopenia in a few minutes. But the research really shows that women who have higher levels of estrogen through menopause and beyond do better as far as bone density goes. So we're going to get to some hormone replacement therapy options here, because there are a lot of options, which is good and bad. Patients may feel confused about what option is best and safest and how long they should use it. So we'll talk a little bit about synthetic hormone replacement, and then some bioidentical options as well. So the Women's Health International study that came out in 2002, I think really scared a lot of practitioners and a lot of patients. And what happened was they were using all synthetic forms of estrogen, which is not what we do. So the outcomes of that study were horrendous. You can see 41% increase in stroke, increase in heart attacks, breast cancer, blood clots, Alzheimer's disease. And so they actually shut that trial down early because women were having such devastating results. But there was no research into bioidenticals at all. So many thousands and thousands of women were taken off their hormone replacement therapy. They experienced side effects, long-term effects like, heart disease and all of these things that come from not having any estrogen in your body. And so now we're just coming around to this idea, and research is following that bioidenticals really don't have those effects. They're much safer and actually are protective against some of those things. So one option is to do patches. So we do get some increased estrogen levels with those, but they're a little bit unwieldy, so they have to stick. You have to be able to absorb those hormones, and absorption is quite variable for topicals, which this is considered a topical. So, the statistic here, 45% of people do not absorb hormone through the skin. Some people absorb some, but not all of it. And so you may not get a complete relief of symptoms. So this is a better option, I think, than oral estrogen, but you can see that there are issues with it. Creams and gels are another option, and I do use those with patients because hormone replacement is not one size fits all. Not every patient is going to do great on pellet therapy. The issue with this is absorption, really. And I have a case study later on that kind of illustrates the problems with gels and creams. But these can be transferred to partners, children, and pets. So if you're using estrogen, you have to be really careful that your male partner is not getting any of that your children and your pets are not getting any of it. And it can be really difficult to get the right amount because sometimes you're applying a lot of cream and it has to completely dry before you can do anything else. So they're probably the least popular treatment for hormone replacement, although very safe, is topical applications. Injectable testosterone for men, you do see more roller coaster effect with this type of injection, and it is a synthetic hormone, so your body doesn't recognize it as well as bioidenticals. So it can be hard to get the right dose for men, and that goes up and then down, and you have to get your next shot, and so it takes a while to level out for those guys. We'll talk a little bit about pellets. So the pellets that we use here through BioTE are compounded here in the US. They are the same molecular structure as what you would see in the human body. So the body just recognizes it as your own hormones. And so that's why we get less side effects and less long-term issues, because we're really just replacing what your body would make. The other benefit is that it lasts around 4 months for most patients, and you do get a steady stream over those 4 months instead of a daily, up and down, or even a weekly up and down with testosterone injections. You do get a nice steady stream of those hormones. Once the replacement is done, you just set it and forget it, and you just come back every 4 months. So patients really like that part of it, that there's less daily applications of any of those creams or injections. So this is kind of a graph comparison of what you might see. The purple isn't oral, so you get a strong dose each day, and then that decreases overnight, so you have more troughs and valleys. Patches, it's a longer term, you get higher levels, but then they come down. And then an implant, although I wouldn't say it's a completely flat line, because you do start to have a return of symptoms after about 3.5 months. Depending on what you're on, you do have a much more steady lab value for those hormones. So why is BioTE a better option? One, because it's the right kind of hormone. It's bioidentical, which means that the body recognizes it. It's the right amount. Dosing is based on your symptoms, your labs, and can be adjusted, each time you come back in. And then it's the right delivery system. So, I don't know if I stress this enough, but oral versus topical, which pellets are considered in that topical because they're transdermal. Oral is probably the most dangerous form of taking hormone replacement. And then I would say topicals and pellets are the safest. So they're safer, they're more effective, and the body recognizes them easily. There's a lot of studies that are out and more to come about pellet replacement, how safe it is, how effective it is, very convenient, and it does offer more protection for bone health, breast, and brain. A little bit about breast health and hormone replacements. Really what we see overall is that there's no increase in risk of breast cancer with testosterone or estrogen replacement therapy done with pellets. It's very safe for that. We do screen for patients that have had a history of breast cancer or a strong family history of breast cancer, and then we have to weigh the risks. But testosterone therapy really is completely safe for all patients. This was a breast cancer study that was done for patients post-breast cancer. Mortality rates were actually lower in the patients that had hormone replacement therapy post-breast cancer. So that is definitely a good thing. Bone health, 55 million Americans a year are diagnosed with osteoporosis or osteopenia. And the most effective way to build bone naturally without having to take any kind of medication would be testosterone. So we do see about an 8% increase in bone health per year with testosterone replacement therapy. Arthritis as well, a very common condition as we age, and testosterone and estrogen can stimulate some cartilage growth. So we do see less joint pain with patients that are on hormone replacement. Brain health, Alzheimer's disease, very common. Cognitive decline as we age is becoming a major health issue, but women are more likely to get Alzheimer's disease and have cognitive decline if they have low levels of estrogen. So it's a good way to prevent those problems in the future. Heart health we touched on a little bit. Really what we see is an increase in HDL levels, which are the good types of cholesterol, and decrease in LDL and total cholesterol with hormone replacements. So we know that, your heart health is improving when your hormones are balanced. And same thing for men, once they get on testosterone, their cardiovascular risk really goes down. Increased HDL and decreased triglycerides and LDL, which again are the bad kinds of cholesterol, those we want to see lower. They tend to grow or have more lean muscle mass, which helps with, blood sugar issues, which all ties into cardiovascular risk. So, the pellet therapy itself, obviously there are possible side effects. What we do see is not many patients experience side effects, but we can have some fluid retention and swelling. I'll say I haven't seen this in one single patient yet so far, or none have reported it. So that's not a very common side effect. What I do see more of is patients having issues with acne and facial hair growth. So, we try and dose appropriately so that those don't happen. But all of these side effects are more common with the first round of pellets, and everything can be adjusted. There's a lot of things we can do to reduce or eliminate those side effects. For me, I've been on testosterone for a year, and yeah, I definitely have more facial hair, but the way I feel is worth it. So I don't mind, I tell patients just pluck or wax or shave more often. But if you feel a lot better, then a little bit of hair growth is definitely worth it. Other side effects, sometimes with estrogen, we can see some breast sensitivity, uterine spotting and bleeding, but all of those side effects are pretty uncommon. So just a recap, hormone imbalance can start at any time. Most commonly, we start seeing it in 30s and 40s for women and men with testosterone, and then estrogen, a little later for women. Not all therapies are equal. If you're going to do hormone replacement therapy, oral is the least safe, topical and pellets most safe. It's not one size fits all, which is why we do a 45 minutes intake with patients to make sure that it's safe, effective, and that this is the right type of therapy for you. And then the other thing that we discuss with patients is when we're looking at lab values, just because you're in the normal range does not mean that you're going to feel good at that range. So for example, testosterone in men, their normal range, I think, is 300 to 700 nanograms per deciliter. But no man is going to feel good if they're in their 40s and they have 300 milligrams of testosterone floating around. They definitely feel much better if they're around 700 to 1100. So just because you're normal range doesn't mean you're going to feel good then. So it all starts with a blood test. Very simple, in office we can do and get lab results back within about a week. So I just wanted to go through a couple of case studies of patients that I've experienced. The first one is a 36-year-old male who came in. His main complaints were low libido, extreme irritability, loss of focus at his job, and weight gain. And he had previously been diagnosed with testosterone deficiency and was placed on, he tried creams that didn't work, and he had tried some natural therapies that really didn't work for him. So when we tested his labs, they came in at 213 nanograms, which really is, closer to a female range, what I would consider. So no wonder he felt terrible. So we did testosterone replacement, 2,400 milligrams, followed up with him in 4 weeks, and he had significant improvement in his mood, libido, drive and focus at work and at home, and his muscle mass increased. So his follow-up lab showed 814 nanograms per deciliter, and that is a much better level for men. My next case study was a 48-year-old female who had had a hysterectomy. And most of these women are put on some kind of hormones, but they may still experience symptoms. So this woman came to me on estrogen and testosterone cream that she'd been on for a while. But she was still struggling with severe lack of sex drive, sleep problems, difficulty to climax sexually, weight gain, dry skin, joint pain, vaginal dryness that was causing frequent urinary tract infections, which is very common. So when we tested her labs, even on the topicals, her testosterone was less than 12, which is nothing. I mean, no woman is going to feel good there, and her estrogen was basically undetectable. So no wonder she was still having symptoms. So we did her hormone replacement, 125 milligrams of testosterone, 12.5 milligrams of estrogen. And when she came back, she had a complete resolution of almost all of her symptoms. She brought me a list. Her vaginal dryness was gone, urinary tract infections were gone, her libido was much better, and she was sleeping, so she was able to, her fatigue was gone, and she described her treatment as life-changing. And that is really what I see with patients, is that their lives are changed when it's done appropriately. So yeah, I just, like to end the presentation with a little time for Q&A, but it just starts with a blood test. Like I said earlier, we can do it in office. It takes about a week to get those results back. And, almost every patient that I've tested, if they come in with these symptoms, is a great candidate for this therapy. So there's our phone number if you're interested in scheduling. And let's see. Does anybody have any questions? Kristen says, what would the taper of estrogen and testosterone be after you place the pellets? So it kind of depends on what you're on, but we usually have you off of those within about a week or so of putting the implants in to try and get you so you don't have a return of symptoms while the pellets are kicking in. Justin, are you able to speak to us? There's an area where you can request to speak. No. Okay. Let's see. There. Okay. So I just wanted to ask Justin, the rep, if he could talk to us a little bit about the actual pellets themselves, where they're made, and just some information about that. All right, maybe not. Yes, Kristen wants to go back to the breast cancer page. So I was trying to keep it kind of short because I know the information can be overwhelming a little bit.
Can you hear me?
Yes.
Awesome.
All right, yeah, if you want to just chat a little bit about, the pellets themselves and BioTE for just a few minutes while I'm going back, that would be great.
Sure. Yeah. So pellets have been around BioTE's been around for about 10 years, and we definitely been changing healthcare as far as educating patients about their hormones and kind of the disease processes that comes along with not having that healthy estrogen and testosterone in your body as well. But BioTE, the pellets are great for a lot of different symptoms as far as fatigue, depression, anxiety, libido, arousal, just many different things of that nature. So do you have any other additional questions as far as about the actual pellets itself?
Well, can you talk to us a little bit about the company that makes them? I know we use Anazael.
Correct. So we partner through what we call a 503B pharmacy, which is they are FDA regulated. So they go through stringent, very rigorous FDA requirements and testing for the pellets as well. So everything in the pellet is FDA regulated, the testosterone, but the actual pellet itself is not due to being a specific dose. But like I said, everything in the actual pellet is FDA regulated.
Okay, awesome. The other thing I wanted to just touch on was the procedure itself. I know I have a lot of patients that have anxiety about getting kind of a procedure done in office. They may have fears about pain, but really it's a very quick procedure. Really you only feel the lidocaine going in, and then after that it's painless for almost all of my patients. You can expect some soreness afterwards, and there's a little bit of aftercare, but there's no stitches that go in. It's just a suture. So patients heal up very nicely as long as all of the aftercare is followed, and it's a pretty painless procedure.
Yeah, for women, it's usually about 5 minutes. For men, anywhere from 10 to 15. And the only thing you'll generally feel is the lidocaine injection, and after that, it's just pressure. So no additional pain.
Yeah, it's a great procedure. We love it here. I've done it on myself. I've done it on my husband. Kristen asked, any allergies that would keep someone from getting pellets? Really only a lidocaine allergy, which I have not encountered yet. I haven't had anybody have an allergy to the pellets themselves because they're very hypoallergenic. But I have, had patients have a slight reaction to some of the supplements that I put them on afterwards. But that's just, that's anything, any supplement you try, you can have an allergy. So the biggest contraindications I have for patients, lidocaine allergy, obviously. And then if you've had breast cancer in the past, we don't do estrogen for those patients, but we can do testosterone. So definitely careful screening of all patients is what we do here. Any other questions, Kristen? Since you're our only attendee. All right. Well, we do have a special for new patients this month. If you're interested, it's $99 for the initial visit, and then we're doing $25 off the next pellet insertion. But yeah, if you have any other questions, you can always give the office a call, and we do free consultations for patients. For free 15-minute consultations, and then $99 for the hormone replacement consult. Family history of breast cancer, that depends on, if there's a genetic condition, then we would have to discuss the risks and rewards of this kind of treatment. Like, for example, my mom had breast cancer, but she had it when she was 40 and it was not genetic. So for me, that's not a contraindication. Somebody who has like a BRCA gene mutation probably is not a good candidate for it, depending on that patient. So, but testosterone really is quite safe, and that takes care of a lot of the symptoms that we discussed, but it's not really going to help with like hot flashes or night sweats. So getting a look at your symptom picture and your history and your family history and your labs is going to be important. All right. Do we do women's wellness as well? We don't, but we have referrals for that. So if you need a well woman exam, we have a couple of referrals in the Prescott area. Holly just joined. We do the blood screening here. Yep. So we draw labs, and as far as labs go, we can run it through your insurance if you have it, but our cash pay price for the initial hormone panel is I think it's around $87, and which is a phenomenal price. So that includes estrogen, testosterone, FSH, a full thyroid panel, a CBC, and a CMP, just to look kind of at baseline. Are you healthy enough to have this treatment? And that's vitamin D and B12 as well. So that's where we start with our lab screenings. So, if you have insurance, we can do it that way. Although for some patients, just doing the cash pay price through my office is cheaper than even doing insurance. And Holly, the webinar was recorded as far as I know, so you should be able to watch later if you're still interested in getting more information. All right. Anybody have any other questions? So happy that you guys showed up and are asking questions. This is great. If a patient is dragging their heels on Nutras, like nutraceuticals, you had to pick two, which would you recommend for them to take? Are you talking about supplements, Kristen? She's asking about.
Correct. Yeah, it'll be the nutraceuticals. In my opinion, I would say the DIM, just for that healthy estrogen metabolism, down the correct E2 pathway, and then I would say the ADK10 as well, just because everybody is pretty much vitamin D deficient, and that's going to play a huge part as far as symptom relief as well.
Got it. Yeah, actually, I have seen great results with DIM, just helping with any kind of side effects that patients might experience. So that's my number one recommendation for any patient that's on any kind of hormone replacement is DIM. I say it's a healthy hormone metabolizer. So that's a great place to get started. And then, vitamin D for sure, because I've had one patient who came in with appropriate levels of vitamin D. Everybody else has been really low. So that's another screening, because vitamin D really is just an overall, you need that nutrient for cancer prevention, for brain health, for bone health. So if you haven't had your D tested in a while, then that's a really good thing to do as well. All right. Anybody else? Any other questions? You have anything else to add, Justin?
I think you got everything.
All right. Wonderful. Well, I thank everybody for coming, and I'm trying to get to the last slide, which takes a while. It has our phone number on it. But just give our office a call if you have any questions or you want to get scheduled. And thank everybody for coming. Have a good rest of your day.